Hello, and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. Our guest is Dr. Nitin Yerram, Director of Urologic Research and Director of Urologic Oncology at Hackensack University Medical Center in the Department of Urology. The goal of this podcast is to increase understanding about clinical trials and help patients and caregivers become more informed so they can talk openly with their doctors about shared decision-making for treatment options. Let's get started. So, Dr. Yerram, can I have you please introduce yourself for our listeners?
Of course. Thank you for having me today, Simone. My name is Nitin Yerram. I'm the Director of Urologic Research as well as the Director of Urologic Oncology at Hackensack University Medical Center in the Department of Urology.
Wonderful. Well, thank you again for being here. So we're going to be talking about clinical trials. So our first question is just to touch briefly on what is a clinical trial and what are some types of clinical trials?
Yeah, great. So clinical trials are research studies in which we kind of investigate a question that we have that relates to patients, right? So it's experiments that we have about a diagnosis, about a screening test, about a treatment for patients who are undergoing some type of treatment. Now, there are different types of clinical trials. There are different indications for clinical trials. Clinical trials can be done in diseases that are cancer-based, which is my expertise, as well as in benign conditions, as well as in quality of life conditions. So there's a wide range of what a clinical trial is, and the definition is kind of varies depending on the purpose. But that said, the goal of any clinical trial is really it's structured around a strong hypothesis that we have as researchers and how it relates to patients. And when we do formulate these clinical trials, we do try to keep the patient at the center of it and how we can best serve those patients as well.
Great, thank you. And what are the phases of clinical trials? Can you talk about each of those briefly?
Yeah, of course. So there's really three main phases in a clinical trial. The first one is called a phase 1, and after that's a phase 2 and a phase 3 clinical trial. To start, phase 1, there's various definitions in how you phrase this, but the way I like to kind of think about it is very simply, phase 1 is it safe? And that's the question that we really try to explore in a phase 1 trial. So in that type of trial, there's typically in the type of trials that I work with, with different type of therapies, treatments for, cancer, we really have different dosages, and we try to see, which dosage may be the safest and most effective. Now, in a phase 1 trial, we can also look at, does it work or not work? But that's really not the main question in phase 1 clinical trial. So again, it's really about, is it safe? A phase 2 clinical trial, the question that we're really trying to answer is, does it work? So we kind of use the data in a phase 1 clinical trial, and that's where we say, this dosage or this type of, treatment is really the best of the options we picked from a phase 1 trial. And then we actually kind of expand that to maybe a larger population compared to a phase 1 trial. So maybe it could be from 10 patients in a phase 1 trial to maybe 50 to 100 patients in a phase 2 trial. Again, those numbers vary based on the question and kind of the treatment we're focusing upon. And we really try to focus again on, does it work? So we treat those patients with the assigned dosage, for example, and we see, is there a response? Do the patients actually react well? And is it actually working? From after a phase 2, there's a phase 3 clinical trial. And the question we like to answer here is, does it work compared to what we normally do now? So our standard of care treatment. And so this is typically a larger trial, maybe up to a couple hundred to a couple thousand patients, depending on, again, the disease and the treatment that we're focusing on. And the question that we try to answer again is, does it work compared to what we're doing right now? Sometimes that's a drug we've used in the past. Sometimes that's observation or, a surveillance regimen. And that's maybe because we don't have a good treatment right now for this, and this is a new treatment. So that's kind of typically how we frame those phase 1, phase 2, and phase 3 clinical trials. Lastly, there's a phase 4 clinical trial that we don't hear too much about, but that's typically after a drug is approved and it's in post-market analysis, and we kind of retrospectively see if this drug is actually working or not. It's not super, it's not something we commonly do, but it's typically done by pharmaceutical companies to see if the drug is actually working once it's already released to the market.
Thank you. That was a great overview, and I think people will find it helpful to understand that breakdown of how the clinical trials come to, be marketed out there. And so you kind of touched a little bit on this when you were talking about the phase 3, but could clinical trials offer better care than standard treatment? Can you talk about that a little bit?
Yeah. I mean, in short, the answer is yes, right? And this may be a question you may ask in the future, but I think some patients have this misconception that clinical trials are for end stage patients, right? I mean, we hear that in the news, oh, I was on a clinical trial because there's no other treatment options, or we kind of hear that in that setting. And the fact is that's completely not true. It's a huge misconception in the public. Clinical trials are available for all sorts of diseases and at every stage of the disease as well. And so at times, even though we may have a good opportunity or a good drug that we use in the current setting, there may be a better opportunity that we've researched and maybe learned about. And so part of what a clinical trial is to assess if the current standard of care is as good as maybe the new experimental drug, right? And so we typically, and especially in a phase 3 clinical trial, kind of use the standard of care treatment, which is what we currently available to the public, and we put that up against an experimental option, and we see what's better. So yes, there is a lot of opportunities, in short, to say we can have in a clinical trial drugs or therapies that are better than the current standard of care.
Thank you. And so here's a question that I think a lot of people are going to be interested to learn about is who should take part in a clinical trial? Who would be a good candidate for a clinical trial for a specific disease state that they're dealing with?
Great question, Simone. And that's a question I get quite often. And the short answer is anybody who's interested, right? The goal of a clinical trial is to really bring people from all sorts of backgrounds, all sorts of diversity, all sorts of disease stages to really get a sense of, does this new therapy or, condition get any better on a trial? We don't want to just have patients that have kind of exhausted all the clinical therapies. We also just don't want patients who've just, been newly diagnosed. We want a whole range of it. I think specifically patients who kind of are interested in clinical research, who want to be able to provide good, not just for them, but their future generations and their friends and their neighbors, people who take an interest about their own disease. These are kind of general terms of patients that would be good candidates. But in all reality, we really want the cohort of the patients that we do clinical trials on to look like the community we live in. All sorts of backgrounds, all sorts of ethnicities, all sorts of diseases. And the best trials actually look like the community we live in.
So I'm sure a lot of people, might be a little bit nervous to take part in a clinical trial or not really sure about the next steps or, how it may benefit them and whatnot. So can you dive a little bit into the benefits of someone participating in a clinical trial?
Sure. I think for a patient that's interested in a clinical trial, I think they come off and they ask to me, they say, doc, what's the benefit here, right? And I think we touched on some of them already, right? One of the benefits is we're able to offer them a new therapy that's not quite available to the public quite yet, right? And when we do offer that therapy to patients, that comes with some data that we may have already experienced in some smaller patients and smaller cohorts. So, I think we have some experience with that therapy, but we're able to say, I think there's some promise here. Maybe we can give this to you as something that may work currently that better than what we already use right now. In addition, what I think patients are going to be able to see is when you're on a clinical trial, there's a whole network of people that really support these patients. We want things to be done safely and effectively. And with that comes a team of nurses, data coordinators, physicians that really help and kind of cater to the patients that are on clinical trial. Patients have been able to say that the support they may have while on a clinical trial is typically more than if they were just to get standard of care therapy. And that's because the network of the team that we have behind these clinical trials. So in general, I think patients are quite pleased with the care and the attention they receive when on a clinical trial.
I think it also may help patients feel like they're taking a more active role in their own healthcare by seeking out things, that may, help them in ways that other care might not have. And a point that you touched on a little earlier that I thought was really great was how, this can help contribute to research and data that can help, generations down the road. So can you talk a little bit about, just some of your experience in the clinical trial space, and, any feedback that you've got in terms of patients who have had positive experiences and feeling, that they're contributing to a greater cause?
Yeah, no, absolutely. Patients routinely that are on a clinical trial that we have here at Hackensack have come back and they said, one of the things that they're proud of is the fact that they're able to, obviously be a part of something that's bigger than just them. A lot of the trials that we have here and at other institutions, they're national trials. So maybe we're one of maybe 20 to 30 to 50 sites in the nation, also around the world. So they're part of a greater network of patients that have said, listen, we're here to fight cancer. Obviously, cancer is the disease I treat, but we're here as a part of a greater network, and we're more than just our disease, and we're really proud to be a part of something that's going to help generations in the future. I've even had patients come back and said, what are the results of the trial I was a part of? Because my neighbor was recently diagnosed with a disease very similar to mine, and they want them to also benefit from maybe some of the therapies or the struggles that they've been in the past. They really want to help their neighbors, their family, their community, and also the next generation. So it's been a really rewarding part. It's been a really rewarding experience to be as a physician as part of clinical trials. But I'll say, I think patients really, really say that it's even more rewarding for them. And I think that's really the best and most exciting part of being involved in clinical trials.
Thank you for sharing that. I think people will be really appreciative to hear that positive feedback. And, hopefully we'll get them thinking about, if this is something that's right for them that they want to be involved in as well. I'm sure patients come with a lot of questions about clinical trials. So what are some questions that people can ask their doctor so that they can better learn if a clinical trial is a right treatment path for them?
I mean, I think it all starts with a conversation with the physician that they're treating them. Obviously patients know themselves the best, and, the physician that they have a relationship with hopefully knows them to a point to know which trials would be better suited for them as well. The questions that I think patients can definitely ask are, how many patients are supposed to be enrolled on this trial? How long has this trial been open? What is some of the preliminary data behind those trials to know, is this treatment safe? Is it effective? Just to get a sense of what the prior data has been. And I think lastly, it's important for that patient to also ask the physician, what is your experience with this trial? What have patients experienced? And, have they enrolled some patients on this trial to understand the experience that they may have with this specific trial in the setting of their disease?
And another question that I anticipate people having is about their privacy and their rights when it comes to clinical trials. So how are people protected when they participate in a clinical trial?
Great questions about. I think one thing I want to really emphasize to the caregivers and the patients out there is that whenever a clinical trial is created or in the process of being administered, the focus here is absolutely around the patient. It's about the well-being, about the patient, and that includes privacy and protection of that patient. Every clinical trial has to be approved by an institutional IRB, which is called an institutional review board. And that board is set up with independent practitioners, physicians, nurses, administrators who are independent of the trial. And they review every word in that clinical trial to make sure that it is patient-centered and the patient is protected at the end of the day. And there's no trial that's open in any institution, whether it be Hackensack or anywhere across in our nation, that is not approved by an IRB. Secondly, every patient that enrolls on a clinical trial is informed, undergoes something called informed consent. So that starts as a discussion with the provider as well as the patient. And follow up, the nurses and any other team members will make sure that the patient understands every detail of that clinical trial before they actually sign that consent form saying that they agree to enroll onto that clinical trial. And then lastly, I think it's really important to note There should never be any pressure for a patient to enroll in any clinical trial. And even if a patient did enroll under a clinical trial, they should and they will have the opportunity to leave that trial at any time. And that's absolutely on the patient's terms. Again, it just emphasizes the fact that all of these trials are focused and created around patients, and they're obviously created to have the patient first in the center of the process here.
That's great information, and I hope that it's reassuring for a lot of people not to, deter them from participating because of that reason.
And Simone, just to add up on that, that's obviously why I think that starts the discussion with the physician, right? These concerns about privacy or protection should never be discounted. And it's really up to the job of the clinical trial team or the physician that's leading it to make sure that we ally those, we understand those fears and those concerns, and we address them. And again, I want to make sure that everyone understands there should be never pressure for anyone to join a clinical trial. That's really on the patient's terms.
That's a great point. Thank you. And so switching gears into the financial side of participating in a clinical trial, are there fees involved with clinical trials, and how can people get help to pay for clinical trial costs that may not be covered by insurance?
That's a great question, Simone. As you know, medical care is expensive, and a clinical trial does have a whole team that supports, the patients when they undergo these things. So there are certain costs associated with it. Most of those costs are shouldered by two people, and it's either the company that's sponsoring this or the NIH that is supportive of trials that may not have pharmaceutical backing. And then the other people that really help with these clinical trial costs are insurance. Most standard of care diagnostic treatments or CT scans or lab values typically are billed through medical insurance, so there should be no cost to the patient. In rare situations, there could be some cost to the patient, and I think most trials are set up to avoid that situation as much as possible. And lastly, it can be up to the institution to help shoulder some of those costs to offset some of the difficulty that it may provide for patients to be a part of a clinical trial.
One of our last questions, where can people find clinical trials for their urologic condition or disease? That's something from the foundation. We do get people who, reach out to us asking about clinical trials for, for different conditions or diseases. So where can they go to find those resources?
Yeah, great question. I think the first place to always ask is your physician, right? Your physician is typically the one who's kind of in the know. They're plugged into this network that we have, and they're the ones to first ask. The second place that patients can go to is disease-specific foundations or websites. For example, in my world, bladder cancer, there's many organizations out there that deal with bladder cancer that can help connect patients with physicians or organizations that really are heavily involved in clinical trials. It's always a great resource, and I typically refer patients to those disease-specific websites and organizations. I think another place that patients can go to are hospital websites. Typically, these are curated by the hospital, my organization, to really put upfront major trials that they have ongoing in different disease states. So that's one place that patients can look to. And I think the last place, and I think it's actually a very useful place that patients can go to, is clinicaltrials.gov. This is a governmental website that mandates every clinical trial, every experiment that's ongoing in clinical research is listed onto this website. And while it may be cumbersome at times to look through, it definitely has every trial in the United States that's ongoing, and patients can look according to different locations and disease state to see if there's a trial that maybe works for them.
Thank you. I hope that patients and caregivers check out those resources, talk to their doctor, to find the best treatments for them and to determine if a clinical trial is a good treatment path for them. So before we end, do you have any final thoughts that you would like to leave our audience about clinical trials?
I think to start, I just want to make sure that the caregivers and the patients understand that clinical trials are a very exciting part of science and of medicine. It's really where the most innovative medicines and tools are really being developed, and we're able to offer those to our patients. We obviously want to do that in the safest, most effective way, and that's why we put it as part of a clinical trial. Secondly, I really want to emphasize that patients of all ethnicities and backgrounds are welcome. I said this before, but the best trial actually has patients that look like the community we live in. And that's really important to have a diverse background of ethnicities and locations to really have a part of any clinical trial so that we're actually able to apply that data to the broader population that we live in today. Another point I really want to emphasize is when we create these clinical trials, the safety and the dignity of a patient is really the first and foremost concern for us clinical researchers. It's really why we do this. And I want to make sure that every patient and caregiver understands that they're not there to be taken advantage of. We're here to help them and to really create an avenue where they can provide something for the greater good for themselves as well as future generations as well. And then lastly, this process can be scary, it can be new, it can be overwhelming, but the number one place that they should go to start to learn about any of this is their physician, is having a conversation. Because at the end of the day, that's really the goal for every doctor who's part of a clinical trial, to really help their patients. And I think that's where any patient should go to begin that conversation.
Thank you. I think that was a really wonderful recap of our conversation. And I hope that patients and caregivers, take away a lot of great information and are able to have those important conversations with their physicians. So Dr. Yerram, thank you again so much for being part of today's episode of the Urology Care Podcast.
Simone, it was a pleasure. Thank you so much for having me.
This podcast is supported by an independent educational grant from Merck. This podcast has been brought to you by the Urology Care Foundation, powered by trusted experts of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.